had a long-standing interest in really understanding the role of the reproductive tract microbiota in influencing preterm birth outcomes. And initially we got into this field trying to look at understanding and categorizing better which bacteria actually colonize the reproductive tract. And then we started in those studies in looking at healthy patients and outcomes. And a lot of our work initially showed that, like others who had used sort of more historical studies that had used sort of culture techniques, we saw a strong shift towards lactobacillus dominance. And in fact, what we found is when we track those women beyond pregnancy and into the postpartum period, we see that concurrent with a decrease in estrogen, we actually see lactobacillus species deplete away. And that sort of ties in quite nicely with the idea that estrogen is one of the mechanisms that helps promote lactobacillus dominance. So my talk gave an overview then of work that we and others have been involved in characterising composition in the reproductive tract in women who go on to actually experience preterm birth. And the analogy I used was sort of a comparison with spaghetti westerns, where we find that the so-called good bacteria that associates with protection against preterm birth tends to be lactobacillus species dominance, particularly lactobacillus crispatus dominance in the vagina. In comparison, women who are at risk of preterm birth tend to be those women who are colonized with high diversity community structures, and these tend to be deplete in lactobacillus species. The second half of my talk was then more dedicated towards really focusing on technological developments that we've been working on and methodological developments to try to really rapidly identify composition, but also host responses in the reproductive tract throughout pregnancy. So the method I described was a technique called desorption electrospray ionization mass spectrometry, or DESI-MS for short. And it's a technique we've developed that we can apply directly to a vaginal swab, and it gives us detailed information about composition, but importantly as well, inflammatory responses. And we can start to use that information, we think, to predict outcomes in women. It's a tricky thing, and one of the things I made a point of covering in my talk was the fact that preterm birth is not just one mechanism that drives it. In fact, there's lots of different underlying etiologies that drive preterm birth. We think infection is an important driver in probably 30 to 40% of all cases. So what we think we might be able to do with our technologies is use it to at least detect a high proportion of cases, or at least of women who are at risk, who might have high risk microbiotic compositions. But also use this as a tool to monitor responses to treatment, and also perhaps to stratify out those women who might best respond to treatments. We've heard quite a lot of discussion in the conference so far about how different intervention strategies to either prevent preterm birth, such as prebiotics or probiotics, are not particularly effective in preventing preterm birth in the studies that have been performed so far. But one of the reasons for that is that we're probably giving that to not necessarily the best patient cohort. So we're hopeful that if we can select out those women who have these high microbiota risk types and actually try to intervene on those, we might actually see efficacy of some of the treatments that we're using currently to prevent preterm birth actually improving. The primary risk factor for preterm birth is actually a previous preterm birth. So there definitely is somewhat a factor there that associates, and probably an element of genetic predisposition. So we can already start to enrich populations and identify those women who are at risk based on their previous history. So that information is useful, but it doesn't still tell us really what's the mechanism that's driving the preterm birth. We can identify some of those populations of women who might be at risk, but we still don't know really the underlying mechanism that's causing the preterm birth, and hence why we're not very good at predicting it and not very good at treating it at the moment. In our own work, we're particularly focused now on trying to accumulate and combine a lot of information and aspects of information that we can capture from different elements of the maternal side that we think collectively will tell us more of a story about both mechanism, but also then you can utilize that information to help predict outcomes better. So for example, we've shown with some of the technology developments that we're involved in, we can capture from one sample not just the metabolic information that is associated to composition, which bacteria are there, but also the immune responses to those bacteria. And really looking at those microbiota host interactions, particularly in women who might be at risk of an infectious-driven preterm birth, phenotype we think is critical. And combining that information will help us to better understand the mechanism and again come back to this idea of stratifying out patient populations that we think might best respond to different treatment strategies, and also help make those objective clinical decisions that we know we're not particularly doing at the moment.